Hi, my name is Remy Bulbul. I'm the Manager for Fund Development across Southwestern Ontario for VON Canada. For over 100 years, VON has been providing care, compassion, and service for men, women, children, and families across Canada. In Windsor-Essex, while we're best known for our nursing programs, we actually do quite a lot of work that focuses on keeping people in their homes with compassion, respect, and dignity, and making sure that people have the opportunities and the options to live their best lives every single day. Let's go take a look and see what's happening with VON across Windsor-Essex. We're sort of talking about how VON really works in a niche kind of a way sometimes to be able to respond to what a specific town even or a region might actually need.
Yes. People often fall through the cracks, and when there's a gap identified, VON has been that organisation that stepped forward, often using charitable dollars to be able to design a programme to fit that need. And making healthcare dollars go as far as they can is pretty much the important bit, because we have an aging demographic. Yeah. People are living longer with chronic disease. Dementia is on the rise, and the needs of the community are just getting more intense. Yeah. So doing more with less is the way to make that those healthcare dollars spread wider.
Hi.
Good morning.
How are you? Good morning.
Good morning, Remy.
Good to see you. Good to see you. I'm well, thank you.
Good. Welcome to our Adult Day program here at VON.
Thank you. So the program's not just sort of for clients who are coming to sort of have that extra socialization and time. It's also a time for caregivers to just have a bit of a break.
Exactly, yes. Upon the assessments, when we have caregivers and their loved one come in, they're very tearful, very emotional, very stressed. So after we go through the process and we get them to come into the program and set them up, you see the relief on their faces. They're like so relieved that there is something out there to provide them that little bit of relief so that they can cope and have their family members stay home longer.
Exactly. We're letting people sort of live every day at home how they want to live their lives with some say around how that goes, right? Instead of being in a sterilized hospital, which quite frankly is just a lot more expensive.
VON recognizes its part in the whole continuum of care in each community. So where VON is able to step up and provide the solution, we do. Where it's not appropriate, we partner.
So we're at the Immigrant Health Clinic over in partnership with the Multicultural Council. We operate in clinics across Windsor-Essex, but what VON is really well known for is our sort of in-home and in-community care. So that's sort of what your background is in, right?
Yeah. People just do better in their own homes. You know, they're able to have their own food prepared for them. Everybody's more relaxed and comfortable. It's a familiar setting for them. They can continue with their beliefs and their cultures, where in a hospital setting, that's very difficult to do. It's very more structured. And so we just adapt to what their needs are and what their beliefs are, and they just do so much better that way.
Really, you find that people sort of flourish a little bit more when they're in their own space?
Yeah, they heal better, they cope better with any illnesses, and it's the family support is able to be there 24/7.
Yeah. If you're going into someone's home, you're not just taking care of a cardiac issue, or it's not just a kidney issue. When they're at home, they've got all of their stuff that they're dealing with. So does that take a different type of education for a nurse who's maybe generally used to working in one space or in one type of area? Is that a different kind of sort of?
It's very different. In a hospital setting, you're usually like on an ortho floor, and that's your expertise. In community, we do from newborns right up to end of life, chronic disease, palliative care. So it's teaching the nurses that whole spectrum of and different levels of care. And we teach each nurse, depending on what their skill levels, and to work within their scope of practice. Right. And with that, we're fortunate to have clinical educators at each site with VON. So we are their support. We're out there doing joint visits, hands-on, and helping them teach and support the families as well.
So another way that VON is really innovative, I find, is in our use of technology and how we use that to not only provide a better sort of patient or client experience, but also to be more effective in the way that we spend money, as well as time, right?
Yeah, so a good example of this is the E-Shift program that VON is a leading exponent of. And that allows for care technicians to be in the home supporting people under the guidance of a nurse or a therapist, connected directly by technology to address any concerns that are evolving in the visit. And what that's doing is it's providing more face time for patients and clients, but also leveraging the use of clinical professionals at a much lower cost per visit.
We use technology in a really cool way and try to sort of be at the forefront of how we utilize technology in making the work that we do more efficient and better for patient outcomes at the end of the day. So what are the different sort of ways that we use technology for our nurses?
Basically, we use every nurse is supplied with their tablets, and through those tablets, it has all the information they need on the patient. So before even going into the home, they have a history on the patient. They know the patient's medications. They have any of the doctor's orders. So it's like a little medical records that they're carrying around. So they can review that prior to going in. As well, they have all the patient demographics of where they're going, so that they have their Google Maps on there. It's all connected through these units, and they can communicate with each other as well.
There's some misconceptions that people have about VON, that we only work with seniors, or that we only work in nursing, which couldn't be further from the truth, actually, right?
That's right. No, it's an incredibly diverse organization, and a lot of people who think that they know VON don't really know VON. We have programs that deal with children right the way through to end-of-life palliative care. So not many people would know that we are the lead agency, the transfer payment agency for the student nutrition program that provides breakfast and snack services to kids in school. And then as people age, we have programs that allow people to stay healthy and strong. It's things like Meals on Wheels, home help services, adult day programs, transportation programs. We have a whole list of things that we deliver, and they're all about strengthening communities.
Right. We're here today at Meals on Wheels, which is one of my favorite places in VON in Windsor. So tell me about what's going on today. It's just a regular day at Meals on Wheels. I know you guys are running 5 days a week or so.
Yes, and as you said, it's a regular day. We have 15 routes, 30 expected volunteers to deliver on those 15 routes.
Oh, wow.
Approximately 180 meals are going out to our clients in the city of Windsor. As you said, it's a wonderful program, passionate volunteers, beautiful clients, and a great kitchen staff.
So what kind of folks are utilizing Meals on Wheels? Who is it for?
Certainly. So seniors, those coming out of hospital, those recovering from an illness, those who need some short-term respite care, they just need some healthy, nutritious food to get them back on their feet. We also provide meals to those who are going through cancer treatments as well. And again, it's self-directed, so it could be long-term, short-term. It's up to the client if they want meals daily or once or twice a week. We'll certainly accommodate that for them.
We have a lot of modifications, so different clients, they need different meals, so we provide that personally for them. And the other, we're trying to cook as healthy as we can with fresh products. Without these programs that helps us out, it would be impossible because there's so much to do and so much care put into it. We need as much help as we can. And the students, the volunteers, the pre-apprentice program, all that put together gives us what we produce every day.
So you're generally in teams of two as a Meals on Wheels team, right? So
driver and a
work?
server. I've done both. It's quite pleasant to go and visit people in their home and have a nice little chat with them and find out what a little bit about their families, and sometimes you meet somebody who knows somebody you know, and
small world.
It gets to be quite an interesting little experience.
What do you like about it? Sort of why would you choose Meals on Wheels?
First of all, it gives me some free time. Last year in the late summer, before I got really sick and had to go to the hospital, and the first meal we got, our daughter was here from Germany with her husband, and so they come running, oh, let's see what you got for lunch. Yeah, they had to come and take a look at it.
That's funny.
Yeah, and it is good, really. We enjoy especially the vegetables and potatoes. We eat meat, and we appreciate it very much.
I love it. What about you, Judy? What are you sort of getting getting out of seeing these same folks all?
It's rewarding, you know. You see that you're doing something that they appreciate, and it's the appreciation that goes a mile.
You've got one of your clients that you've had on your route for a little while, and you've gone into their home and you notice that maybe they're not as mobile as they used to be. And so, you know what? Maybe a smart class. You know that VON provides smart classes, and that they are, maybe that would be interesting for you to do. So we're here at the YMCA where we're running one of our smart classes.
Yes.
So what does SMART stand for?
SMART is Seniors Maintaining Active Roles Together. It's a research and evidence-based exercise and fall prevention program for older adults and seniors, and it's actually free.
Oh my goodness, so anybody that's a senior that's wanting to sort of exercise, is that just sort of what it does, is kind of provide a space to exercise, or does it do a little bit more than that?
So we have different classes throughout Erie, St. Clair, Chatham, Sarnia, Windsor. And we have classes in rest and retirement homes, in various community locations like the YMCA, and in-home one-on-one for folks that can't get out to a community class. Part of the SMART program is fall prevention education. And the fact that most falls are preventable. And so we teach people about what those known treatable risk factors are, and what to look out for to help folks understand and minimize their risk of having a fall, because falls are the #1 cause of injury, related visits to the ER, and injury-related deaths, especially among our senior population. 95% of hip fractures occur because of a fall. But it's also interesting to know that research shows that exercise as an intervention on its own reduces injurious falls.
So we don't do any of this alone. We depend very heavily on our community, right? Some programs are funded completely through donor dollars, right? They're funded completely through charitable dollars. But we do that work in partnership with so many other people. I think that it's interesting that people don't necessarily know that VON is a charity, right? That VON actually needs their help.
VON helps to pull all that together through identifying unique programs and partnering with others. And oftentimes it's the charitable piece that allows those programs to start.
Right.
And there's been a whole number of programs that VON has innovated around using those charitable dollars that are now part of the fabric in communities.
Right.
And that's really important.
So it's up to our communities to be able to do that.
Yeah, VON has incredible people working there, you know, people that literally give their lives to the care of others. And that's not just the staff, it's people that volunteer as well. I mean, we have volunteers that have volunteered for VON for decades, like 30 years or more. And it's almost like a lifetime of service. And that passion and commitment is something that I think sets VON apart.
As we've seen, VON is doing more than just providing nursing programs. It's doing more than just providing basic care to people. It's providing compassion, it's providing dignity, and it's giving people the opportunity to live their best lives every single day. Because of you, we're able to make that happen. Whether it's through volunteering, becoming an advocate for those who need our services, or by giving your donation, we're able to do that work in the best way possible every day.